Welcome back. Drug addiction and opioid abuse have claimed millions of lives. But how do we decrease addiction to opioids and still treat the millions of Americans suffering from chronic pain? Dr. Vic Mahindru with Pain Specialists of Boston has new information about alternatives to opioids that can be used for pain management. Welcome.
Thank you for having me.
I'm happy to have you here. Opioid abuse is a huge problem across the country, so the idea that we could have a way to manage pain without it is very exciting to me.
That's right. This is a national healthcare crisis. It is definitely an emergency. There is a lot being done by pain management practitioners to provide state-of-the-art care for our patients. So what that means is we now have options available to our patients to curb the use of these medicines and provide state-of-the-art technology and provide them pain relief.
Excellent. Talk to me about some of these alternatives.
One of them is called spinal cord stimulation.
Okay.
It is a state-of-the-art technique. It has advanced tremendously over the last many decades. By placing this device in a patient's back, we can interrupt the negative impulses of pain going to the brain.
Oh my goodness. Okay, so basically, are we talking about something that taps into like the nerves? Because that's where we feel the pain, right?
Absolutely. We can target the nervous system. We can target a nerve, groups of nerve, body parts, specific anatomical structures. The technology has advanced tremendously.
Oh, wow. I'm thrilled by this because I've had patients who manage pain and it leads to depression because they just don't know what to do about it.
Absolutely.
Why is managing pain so critical?
Let me first define pain.
Yes.
It is an impulse, a negative impulse that is triggered by an emotional response. And so somebody gets hurt, they develop pain. And if they develop pain that continues to persist more than 3 months, it can become chronic. Our goal is to help control the pain, prevent it from becoming a chronic problem.
Okay, and is there a type of client who's more inclined to manage pain or have to deal with this issue?
We see everyone from head pain to toe pain, from young mothers to fathers that want to go back to work, to retired senior citizens that have had back surgery that have unrelenting pain. Our goal is to provide solutions, give them life in a pain-free setting.
Yeah, that's something I'm sure they want to have. What else should we know about these alternatives?
By seeing a pain practitioner, discussing your condition and doing a good analysis and a diagnosis and discussing non-opioid treatments, because opioids don't have to be a first line of defense.
Okay.
We have many options available to our patients.
And it's really good because so many people, when they think about someone with opioid abuse, they think of, you know, your druggie on the corner, but this could be your soccer mom, this could be anybody. At least there is a resource that all of those people can go to. Absolutely.
It doesn't mean opioids are necessarily a bad thing. Some patients do need opioids. We provide opioids for certain chronic conditions. We provide opioids for patients with cancer. Opioids are used during surgery and anesthetics, but they don't have to be the first line of defense.
Good point, Dr. Mahindru. Thank you so much for being here and sharing this enlightening information.
Thank you for having me.
We appreciate that. Stick around. We'll be right back.